Hi, Dr. Lindsey here. This is a very quick video. It's 13 years out from 3,500 grafts up front in a frontal U fashion. So way back, before I got a mustache, before I got much gray hair, I met this fellow from out of town. And he had a little tuft here, but otherwise was probably class 5, maybe even bordering on class 6 hair loss. And interesting guy, and we ended up having a long discussion about whether we do any hair here or we just work around it. And if you watch enough of my frontal U videos, the answer is I don't know when any of those hairs are going to go away. But certainly look around and you'll see some people that even though they're bald, quite bald, up to the middle of the hair, they still have this tuft. And so the advantage of working around that tuft is that at a week or a month, you still have hair here to frame your face. We haven't shaved it. And you have more hair to spend further back on your scalp. The downside is sometimes that goes away pretty quickly. And I think there are 2 cases of mine that are frontal U's that we're talking just like this, and I noticed at a year that we didn't do much in the front, and it's because we worked around that and it had gone away. But anyhow, this has been about 15 years now for this patient, and the tuft is still there. And several other of my patients are like that. There's a few other videos such as that. So anyhow, he came in and we came up with this plan of working around his frontal tuft, which really wasn't a lot of good hair. And we did this procedure, 3,500 grafts. And at a week, he had done great cleaning. And then at a month, as you know, all the hair's fallen out, but he still has his tuft is there. And he's a tall, active fellow. And I recall him saying that people didn't really notice he had anything done after a week because he still had this tuft and he didn't have much hair there before. I gave a lecture at the University of Virginia at his 9-month follow-up, and he came to that lecture. And here's pictures of him taken in the room in which we did the lecture. And then at 12 months, he looks really quite good. He's got kind of an unruly hairstyle. And if you look carefully, I think that the worst part of his hairline is the part we didn't do. But it's still gave him good coverage, and he was happy. And I remember he had gotten in a relationship and gotten a new job. I think he'd opened a bakery or something. And everything went really well. So 3.5 years later, I ran into him at a Led Zeppelin cover band. And you know that he's got really good hair. I blocked out his eyes. He didn't want that to be shown on the video. I know it looks like we're both high, but we weren't. It was just the picture. And so I hadn't heard from this guy forever. And then I got an email from him a few months ago, and he wanted to do some work in his crown. And I said, send me a couple of pictures, and can I do a video of it? And he said yes, if I could crop out his face. And so here's his 15-year result from a 3,500 graft frontal U, and he's still got that tuft. And he's got a big bald spot in his crown, just like he did before. And I think at some point we will do a second case on him and hopefully do an interview with that. So in summary, hair transplants generally last for the long haul. Second, it's hard to know whether that tuft is going to stay or go. And so if it's real thin and weak, it's probably best to go ahead and do it. If it's not, you can always come back and do it later. But here is a guy 15 years that looks completely unremarkable after 3,500 grafts working around that tuft. We do these all the time. If I can help you, please give me a call. Thank you.